And you know, again, maybe the second Jeopardy question that you seem to love, how many Canadians are visiting food banks on a regular basis?
Well, far too many. I mean, I think the question I would pose to you is...
No, you're not asking me questions.
Sure I can. I mean, that's absolutely my prerogative. You don't have the opportunity in a democracy to tell me what I can and can't do, Mr. Ellis. You cannot like it. But I'm saying that I just spent 5 minutes talking about solutions. So do you want to talk about solutions to the issue that you just raised, or do you want to just play this game where you're now going to say some statistic? Because I'm not interested in that, to be honest.
As a matter of fact, Minister, I know that you don't know the answers because we've well established that. Or you're too embarrassed to say that 2 million Canadians access food banks on a regular basis because of your government's reckless spending.
Hey gang, what's up? Aaron right here, Canadian Looney. How y'all doing? So Mark Holland is a bully. He's the Minister of Health and a total jerk, a loser, a clueless clown fool. He's taking on Dr. Stephen Ellis, LEILA Goodridge, TODD DOHERTY, and he is an absolute bully. He thinks he can just say and do whatever he wants. The rules don't apply to him. He's a loser, guys. Let's take a look. Mark Holland getting stuffed by conservatives. This is our Minister of Health. Our health is in trouble. This is a jackass of a minister. Everyone has an opinion about Canadian federal politics.
Oh, yeah.
You know, 20 seconds of context. You know, I love playing Jeopardy, but this is an important conversation that we need to have around the future of healthcare in this country, and certainly is deserving of more than staccato 2-second questions. And I look forward to that opportunity to illuminate and have a conversation on the ways that we can work together to the betterment of our health system.
Thank you very much, Minister. I'm sorry to, but I'm going to be honest with you about your expectations. The rule that we've followed really since I took the chair on this committee is that the witness gets as much time to answer the question as the person posing it takes to pose it. There is an entitlement to cut you off if you go longer than the length of the question. They don't have to exercise that. They're free to let you continue, but it is up to them once you exceed the length of their question in your answer. I think what you will find is if there is one party, perhaps the official opposition, that tends to cut you off, you may find that there's another party that will give you a chance to expand upon your answer in a subsequent time slot. But the rule that I will be applying is the one that I just explained to you. You will have as much time to answer.
It's more a spirit than I appreciate your adherence to the rules and respect that, Mr. Chair, of course.
All right. So we're going to start now with rounds of questions in the manner to which we have become accustomed with Dr. Ellis for 6 minutes.
Thanks very much, Chair. And to you, Minister, you talked about illness prevention. Can you tell Canadians how many Canadians, in percentage-wise, are struggling to access fresh food, fresh and affordable food in Canada? You like the Jeopardy question, so here's number one.
Yeah, well, I suspect that you have an answer. I never quite understand why you ask me a question that you seem to have an answer to. I mean, food insecurity is very serious. I hope that we could take a second to talk about the answers to food insecurity. It is a devastating impact in First Nations communities, rural, remote communities. It is a very difficult thing to quantify because you have food insecurity that takes many forms, whether or not it's access to fresh fruits and vegetables or whether or not it's access to food at all. We have food deserts. So it's
Again,
difficult
Minister,
to enumerate.
thanks very much. It's clearly that you don't have the clue of what the answer is. It's 32%, which is almost a third of Canadians. And you know, again, maybe the second Jeopardy question that you seem to love, how many Canadians are visiting food banks on a regular basis?
Well, far too many. I mean, I think the question I would pose to you is...
No, you're not asking me questions.
Sure I can. I mean, that's absolutely my prerogative. You don't have the opportunity in a democracy to tell me what I can and can't do, Mr. Ellis. You cannot like it. But I'm saying that I just spent 5 minutes talking about solutions. So do you want to talk about solutions to the issue that you just raised, or do you want to just play this game where you're now going to say some statistic? Because I'm not interested in that, to be honest.
As a matter of fact, Minister, I know that you don't know the answers because we've well established that. or you're too embarrassed to say that 2 million Canadians access food banks on a regular basis because of your government's reckless spending. Given that statistics, when you look at it, what about your temporary tax trickery? You know, when you begin to look at this, why don't you enlighten Canadians as to the actual GST amount on things like fresh fruits and vegetables and unprepared meats? What would that be?
Well, first of all, access to food banks and policies surrounding it deal with poverty. This is the government that for the first time set targets on poverty and has met them every single year. Well, we've seen too many people increasing in poverty. We see much lower levels than we saw in 2015 when we had a government, and the Conservative government, that never prioritized poverty or people who were living in food insecurity. So I would ask you what policies you have, Mr. Ellis, that would address these issues. I can enumerate the policies that we have to deal with both food insecurity and with
Minister.
food banks
it's
that are global issues,
Minister.
but as far as I'm aware, you have no
Minister.
policies on these ideas.
Dr. Ellis, please.
It's interesting because I would suggest that my job, as being in the opposition, would be to hold you to account, not to give you policies. So please tell Canadians the GST amount, it's a simple answer, on fresh meats that need to be cooked and fruits and vegetables.
So I disagree. I was in opposition. I absolutely, when I was a public safety critic, advocated for changes in policies. You have advocated none. If you're going to raise poverty and say that you care about food banks or insecurity or any such matter, having absolutely no policy that addresses those issues is irresponsible. And simply just criticizing, anybody can do that. I have a 10-year-old can do that with Google.
Thank you very much, Minister. You know, it's very clear that you do not understand that on uncooked meats and fresh fruits and vegetables, there is no GST, which directly relates to your temporary tax trick on behalf of Canadians, sadly. Can you then go on and perhaps describe the actual foods which GST will be eliminated off of with your temporary tax trick?
Well, I'm here to talk about the supplementary estimates. And so you want to talk about, again, having no policies. I can ask you, why did you vote against the Canadian Dental Care Plan? 34,000 people in your home province have access care, a program that you said didn't exist. You said nobody would sign up for. More than 90% of people have now signed up. Why do you oppose dental care for people? Why do you, as a physician, not understand the importance of primary care that dental care represents?
You know, it's interesting, Minister, because when you look at your temporary tax trick, it actually goes directly to your program with respect to dental care, because, of course, on behalf of Canadians, you voted to remove the GST on candies, candy floss, chewing gum, chocolate, popcorn, coated or treated with candy, chips, crisps, puffs, curls, sticks of popcorn, et cetera, et cetera. And could you tell me that the benefit on the dental health of Canadians that your tax trick would provide?
You might recall that this same measure was suggested by Aaron O'Toole as a temporary measure to give people relief and to give them a tax break, of something normally the Conservative support, but you don't in this instance. So I would ask again, what are your policies to deal with tooth decay? What are your policies to, actually it's to cancel dental care. You would take dental care away from people. It takes some nerve to talk about sugar on one hand and talk about axing dental care on the other. So you want to talk about oral health? What is your policy on dental care, sir?
It's very interesting, Minister, that you refuse to answer any of the questions, because that's why we invited you here, is to attempt to get some answers, which obviously you actually refuse to do. What about when we look at, Minister, the wait times in this country? Maybe this is easier for you. Can you talk about the recent report released by the Fraser Institute and talking about the longest wait times for care in the history of this country, which has happened, sadly, but not surprisingly, under your watch?
Well, actually, it's largely, you also know, of course, it's shared responsibility with the provinces, but the CIHI report actually showed, which is an independent report, progress in all of those metrics. But let me come back to it. Talk about sugar. You're against giving people diabetes medication. So, you know, you're going to talk about what we're doing on sugar, and you're against diabetes medication? You're going to criticize us on sugar in somebody's mouth, but you're against dental care? Sir, are you a physician? And if you are a physician, what would you do about people's oral health other than cut their dental care?
Sugar, Minister, you're laughable. Your answers are actually quite hilarious on behalf of Canadians. I think it's absolutely shameful that you do not understand how things work. So you want to give them diabetes medications because you want to give them more sugar?
Point of
That's your
order.
time.
Shameful.
Point of order, Mr.
That's your time, Dr. Ellis. A point of order from Ms. Sidhu.
Let's be respectful to each other. That's what I just want to request. Thank you.
Respect is earned.
Yeah, it certainly is. All right, that's it for Dr. Ellis. Next.
All right, watch right here. Like, Mark Holland tries to be a bully against somebody that cannot be bullied. Todd Doherty is not stepping down at all.
Next, Mr. Doherty, please, for 5 minutes.
Thank you, Mr. Chair. Minister, everything good? Yes, sir. You're okay?
Yourself?
I'm good. I'm bright as rain. Just seemed to be a little bit on edge a little bit earlier on. But are you familiar with waiting your turn, wait times for healthcare in Canada, the report that was issued today?
I'm aware of it. I haven't had a chance to look at it. It was issued
So
today.
well, it's interesting because, Minister, it says that report reveals that out of 30 developed countries, Canada is ranked 28th in availability of doctors, 25th in hospital beds, 25th for psychiatric beds, 27th for MRI machines, and 28th for CT scanners. That's your record.
Actually, it's, I mean, I love how you don't hold Ford or any other government accountable for provincial health care. Health care is administered provincially. I'm not sure if you're aware of that. But we do try to.
Minister, I'm being respectful. You don't
No,
have
but
to
that
be
wasn't respectful. You just said that it's something that's under provincial jurisdiction is our responsibility. That's not respectful.
Minister, that's your record.
But that's not true.
That is your record.
What are you asking about Doug Ford? What do you think the provincial government in Ontario should do?
Is Doug Ford in front of me right now? You're the Minister of Health.
Right. And so what we did is sign agreements with every province and every territory, $200 billion.
So out of 30 countries, you're happy with that?
That included metrics in every single. No, absolutely. Look, I am not happy or satisfied with where we are in healthcare. But the point is that we have one of the best health systems in the world, that when it comes to primary care, we can do
Minister,
much better, and we are. But provinces have to do
time.
their fair share, and not holding provinces to account is not responsible.
Mr. Doherty, please.
Minister, under your management of this file, 7 million Canadians are without a doctor. What have you done? What measurable steps have you done in the year and a half that you've been the Minister of Health to make sure that those 7 million or Canadians have access to nurses, to doctors? What have you done?
Well, I wish I had 20 minutes to answer that, because it's a very long answer. The first one starts with agreements with every province, every territory, $200 billion, common indicators across the system. With those common indicators, commitments on specifically doctors, nurses, and improvements in primary care. First High data out last year.
Canadians.
I believe I still have about 5 or 10
yes,
seconds.
keep going.
So,
Yep.
The first High data showing baseline report last year shows every province, every jurisdiction, almost without exception, ahead in doctors and nurses. That when you take a look at the investments that we're making in that I just talked about, C72 or health data, I can't say it fast enough because I got so much to say on it. It's great news.
You have a mandate letter?
Yeah, absolutely. It's a continuation of the preceding mandate letter.
So, Minister, you've been in this role for a year and a half, and yet Canadians have yet to see what your mandate letter is. Who sets your priorities?
Well, I think at the beginning I enumerated my priorities very clearly. Pharmacare, dental care, data transformation. Where do you stand with Bill C-72? Where do you stand on dental care? Where do you stand on pharmacare? What is your position? How are you going to fix? How are you going to fix?
Minister, in a year's time, you'll have lots of time to ask all the questions.
No, I won't, because you'll still be in opposition, because you can't answer questions about what you're going to do for health care. No, what are you going to do on health care? How are you going to fix those problems? What is your policy
Mr.
solution?
Doherty, please.
Thank you.
What is your policy solution? Do you have any? No.
Minister, you're the one that's in power
Doherty.
right now. You've been in power for 9 years.
What is your
And yet
solution?
we're
If you're gonna
failing in
criticize, what's your
every
area?
metrics, Minister.
Your
A year
solution
and a
is
half.
cuts.
A year and a
You think
half.
cuts are going to
You're
bring
a failure,
doctors and
Minister.
nurses?
Please allow him to pose the question. Go ahead, Mr. Doherty.
You're so disrespectful. And weak. And you can stare at me all you want. Like I've been, mean mug me all you want. But Minister, the rates of scurvy are on the rise. Yet you're taking off the GST on pop and chips and candies, but you are raising the cost of everything healthy with your carbon tax. What's your rationale for that?
A, it doesn't increase the cost. B, if you cared about scurvy, then you'd be talking about initiatives in First Nations communities. The scurvy you're speaking about is in rural, remote communities. The policies that you have to deal with that are exactly nil. And I find it, yes, I'm very frustrated, Mr. Doherty, that the Conservatives would talk about issues like poverty. You know, I was in opposition. I watched you never talk about poverty. You never set poverty guidelines. You have no policies or ideas on poverty. In fact, your cuts will do devastating things to the very issues you're talking about. And I think it is dishonest and disingenuous when you have no solutions.
Mr. Doherty, please.
Mr. You're the only one that's talking about conservative cuts. The only thing that we're talking about is axing the tax for everyone forever. That'll make life more affordable for all Canadians. The only one that is spewing rhetoric and garbage are the Liberals and the NDP, their coalition partners. So if you want to start telling the truth, that's, that'd be a novel idea.
So let's start with
So
scurvy. then.
Minister, no, it's my time, not yours. So, I didn't. So, Minister, over 47,000 Canadians have lost their lives due to the opioid crisis. You've spent, your government has
Doherty,
spent $1 billion on failed policies.
Your time is up. Get to your question. We'll let him answer it, and then we'll move on.
Minister, what's your comments to people like Brianna McDonald's families that all they've asked for is for this government to stop their decriminalization and their failed
25
drug
seconds
policies?
over time. Minister, please take 30 seconds to answer the question, then we'll move.
Thank you. In the first order, any person, and I know that you would share it in my heart, and you would share it in yours, that anybody who loses a family member is devastating. And we need to use science, data, evidence to provide solutions, not emotions and not fake policies. So we have to provide real answers, and that's what we will offer, true science-based, evidence-based decisions to save people's lives. And if you take scurvy, and I'll just finish on this because you want to talk about facts, somebody who's so food insecure that they have scurvy doesn't drive around a car. They don't pay carbon tax, but you would take away their check. You would take away the benefit that they get every single quarter that helps them pay for groceries. That's what you would do.
Thank you, Minister.
So you would leave them less secure and in a more vulnerable position. Sir, those are the facts.
Thank you, Minister.
Here we have LEILA Goodridge. She's great, nailing, again, this bully, Mark Holland, our loser. Health Minister. Health is in a crisis if this is our minister. This guy's clown. Let's take a look.
Thank you. Thank you, Mr. Julian. Next, Ms. Goodridge, please, for 5 minutes.
Thank you. So, Minister, we had BC RCMP Assistant Commissioner Wilnig come into Health Committee about 6 months ago. He was talking about the very serious concerns about how 80% of the precursor chemicals used in fentanyl production are still legal and unregulated in Canada. Why has Health Canada been dragging its feet for the last 2.5 years to do anything on this?
Well, I think one of the greatest concerns with this is a lot of these precursor chemicals are used in normal legal commercial enterprises. So it's very hard to stop some of this because a lot of what's being used can be found in legal products. So, but I deeply share this. This is one of the things that's being worked on very actively now as we have a conversation with our American counterparts. How do we do this together? And I think a North America approach where we're working collaboratively across North America makes full and complete sense.
So because the U.S. finally has said this is enough's enough, you are finally going to take action. You've been in government for 9 years. Why won't you actually take immediate action to make sure that Canadians are safe? Canadians are dying every single day. 22 Canadians are dying from addiction every single day under your watch.
So the problem with fentanyl is that it is so insidious. It is so easy to manufacture, to hide, to send, and so it is so devastating. And we have absolutely been taking every action that we can to both block the precursors. I explained the complication with a lot of them being legal, and also to take action to stop the supply. That's nothing new about working with the United States. It's about trying to have a conversation with a new administration about how we collaborate better. But the action that we've been taking is doing everything that we can on the basis of evidence and science, and I can assure you that I care about it about every bit as much as you do.
Ms. Goodridge.
So what Canadians can hear from what you've just said is you're doing nothing and you're okay with that. So back to this whole conversation around scurvy. Food inflation has increased 36% higher in Canada than it has in the US, which means the carbon tax that you guys continue to jack up, and you plan on jacking up again come this spring, is going to further make food more expensive. Canadians are now getting scurvy. Your plan to remove tax for a couple months on Chiefs Puffs and chips. Why not make healthy food more attainable so that Canadians can eat?
So as I just explained, scurvy is existing in communities of extreme food insecurity, mostly Indigenous. These people don't have cars. They're not driving around. They pay no carbon tax, but they do get a carbon rebate. Your policy would be to take the rebate away from them. I can guarantee taking
Minister?
cash away from somebody is not going to help them not have scurvy. And I would ask, what are your
Minister-
policies? I can tell you what our policies are around food insecurity. And then the second thing I would say, can you tell us whether or not you support vaccinations? Full stop. Because a lot of misinformation around vaccinations and a lot of misinformation around diseases cause problems. And I've been trying
Minister?
to say that we should have
Thank you.
a unified view on these issues.
Quite respectfully, most of these communities that are seeing scurvy increase are in the north, where they do in fact have to pay carbon tax to heat their house, to keep the electricity on. That's a bill they see every single month as a direct result of your government's policies. And frankly, it's really rich for you coming from a Southern Ontario area to be sitting here lecturing me on what food insecurity looks like in the north, someone that lives north. So I'm sorry, Minister, this is absolutely part of the problem. If you guys just got rid of the carbon tax, people could afford to heat, eat, and house themselves. Why won't you take the carbon tax off?
Because that's disingenuous and untrue. That the people that you're talking about who are so food insecure that they have scurvy are almost exclusively in Indigenous communities. These are people of very limited means that are not paying next to anything in terms of carbon
So
tax.
you're okay with that?
What I'm
So
saying,
you're okay with
what
people
I'm not
having
okay,
scurvy?
I don't know if I'm allowed to finish.
Yes, you
If
are,
I'm allowed to
please.
finish,
Yes.
the point that I'm making is that these people get way more back in a rebate check that they can use for food insecurity. You would take that away from them. So in other words, you would, in terms of a price on pollution, you would eliminate the action on pollution and protecting our climate, and you would then take away money that they get where they would be left in an even more insecure situation. And I think that's
So then-
disingenuous
okay,
to
how about
saying
let's
somebody
shift?
who's suffering that you're going to
Thank
take
you,
away
Minister.
money that they need.
Quick, just a
What
short
have you
question.
done to improve the people that are getting scurvy today? What has your government done to make sure that Canadians are not getting scurvy?
Just a short
Have you
answer,
done
Minister,
anything?
please.
So the first thing is we've tripled investments in First Nations communities and are taking historic action in First Nations communities. Those are way over the levels that were there under the Conservatives. And I can tell you the number of boiled water advisories in those communities and poor health outcomes were much worse under Conservatives and would be again with the cuts that you would visit upon them. In terms of the country writ large, things like the school food program, things like
So you've done
making
nothing
sure
to
that women have
actually
access
help
to
the people-
child care so that
Thank
they
you.
can afford child care, making sure that people get the savings that come from dental care and pharmacare. That's real help.
Thank you.
Making cuts isn't going to help any of those people.
Thank you, Minister.
So we'll wrap it up right there, guys. Minister Mark Holland, Health Minister, gym teacher, like used car salesman, total liar, bully, prick. Like, he's just a gong show all the time. Stephen Ellis and him have a rivalry. You can tell they personally have problems with each other. So funny. Aaron, Kennedy, and Looney, like, share, subscribe, trying to show as much as we can of these committee meetings. They're always wild. Thank you for watching this video. Catch you next time. Mark Holland's got to go. We need an election as soon as possible. Thanks for watching. We'll catch you next video. Everyone has an opinion about Canadian federal politics.